You're with News 5 tonight. The number of chickenpox cases increased by more than 25% in just 1 year. In 2006, there were some 24,000 cases, but this went up to more than 30,500 last year. The disease can cause serious complications, yet many parents don't get their children vaccinated.
Vaccinations are never popular. But the chickenpox jab can prevent children and adults suffering from the misery of itchy spots or worse.
A lot of patients have this thinking that it is a rite of passage. Everybody needs to get chickenpox. In young kids, it's a very mild illness most of the time, but they do get complications with brain infection, with pneumonia. You can die of chickenpox, although it's very, very rare.
About 30,000 children and adults get the jab in Singapore every year. Christine Ng had her 3 children vaccinated because of the risks of the disease and practical consequences such as missing school.
They have to stay at home for at least 2 weeks, isolate from the rest of families, so it's a lot of inconvenience for us.
Another concern is infection of chickenpox blisters, which can cause scarring. Christine had a bad case of chickenpox when she was 19, leaving a scar on her forehead. Laser and minor surgical procedures are available to treat chickenpox scars, and up to 20 patients visit this clinic every month for treatment.
To get 100% clearance is difficult but not impossible. But I would say most patients get 50–60% improvement in the scars. Of course, deeper scars tends to be harder to treat, and they need multiple treatments.
Prevention is better than cure when it comes to scarring, and the chickenpox vaccine is up to 90% effective in preventing the disease. For those who have the jab but still go on to get chickenpox, doctors say they're much more likely to have a milder case of the disease, and therefore a much lower risk of complications and scarring.